Today's panelist conversation asks one very important question. How do we translate holistic wellness into programs that actually scale and actually work? Lately, I'm hearing more and more people are investing in wellness, but burnout is still high, chronic conditions are climbing, and a lot of programs can't show real results. The people feeling that gap are the ones on the ground, including clinicians, practitioners, coaches, and employees who are just tired of fragmented care and perks that just check a box. Welcome to Shifting Pathways, where practitioners and leaders get real about how work is actually evolving. I'm your host, Sapna Sheth. Today, we're talking about something that sits right at the intersection of human well-being and business reality. How to translate holistic wellness into scalable programs that deliver real outcomes and real return on investments. Healthcare organizations and employers are facing rising costs from preventable chronic conditions, burnout, and fragmented care, while traditional wellness efforts often deliver low engagement, unclear results. And at the same time, whole person and integrative models are showing that when you address physical, mental, social, lifestyle factors together, people actually do better. Surprising. Leaders now have powerful levers, including data, digital tools, and even AI. And these things are there to personalize support and measure impact. But most are still wrestling with how to scale these approaches in ways that stay human, equitable, and sustainable. So instead of another abstract conversation about wellness, I have brought together 4 people who can see a different piece of this entire puzzle. I'd love to introduce you guys to these amazing panelists. Sean Agnew is here to talk about scaling, growth, and leadership, how we move from pilots and passion projects to real, investable, whole person health offerings. I met Sean at a conference where he was not only grounded himself, but he also, without knowing, grounded me. Gave me sense of calm, just this presence that he had that gave me a sense I can breathe and I should just calm down right now. It was wonderful. So then I scheduled a one-on-one with you, Sean. I was telling you my ideas and I wanted, I was kind of going through this whole, this is what I envision. And you said, Sapna, if you believe in it, then just do it. I don't know why you're telling me more. Just go out and do it. So his advocacy for his community and those around him is just powerful and inspiring. And I'm so grateful that you're here. Thank you. Ariel Hubbard, she is now on my speed dial. She brings the raw human side of whole person health. It's what changes when we treat people as full humans, not just diagnoses. Oh gosh, she shares knowledge about, how deep people can heal in ways that not every practitioner holds. Her energy and her interest to be supportive to people in their spiritual and holistic healing is incredible. So welcome. Thank you for being here, Ariel. Greg Gravera grounds us in clinical prevention and longevity. His whole persona is how whole person care changes patient trajectories over years, not weeks. Takes time. He's there to be supportive and advocate for you throughout the whole journey. I was on a call with Greg where he shared this, and I think it's so powerful. He said, my value is not just what I know. It is how quickly I can turn what I know into usable direction for someone else. I don't know if you recall saying that, Greg, but I jotted it down. It was after we were going to do this podcast together. It's powerful, but it's not just words. Like, I feel like you live it in every conversation. So
thanks.
Thank you. Hi, Jennifer Taylor. She focuses on behavior change and program design, how to build journeys people actually engage with and stick with over time. This is an incredible add to our conversation today. And I'm really looking forward to engaging Jennifer in more ways than one. She's like, I want to talk to you about, your podcast and things. And then it happened. And there's so many directions I could leverage this woman. Let's do healthcare first. So thank you for being here. Man, you guys are power. I can't believe it. This is going to be so much fun. So let's get into it. Greg, why don't we start with you? Where would you like to lead in the direction of this business case today?
So, there are a couple of things. Thank you. First and foremost, now, a couple of things that I'm excited to share because of this conversation. I think that whole person wellness isn't a nice to have. It's a has to have, got to have. It's becoming, thankfully, more of outcome measurement when we're talking about clinical outcomes, organizational outcomes, human necessity. These are really important things. I'm a nurse practitioner. I got my doctorate in nursing, and I'm taught to think a few different ways, right? In my undergraduate, I was taught to take a look at a person and help figure out what's going on. Not just let's look at numbers, let's look at a white blood cell count, let's look at the totality of the person and see what's going on. As a nurse practitioner, it was taken a little bit step further where let's try to come up with a differential, right? Not just looking at numbers or blood pressures or what have you, but taking a look at the whole of the patient and the caregiving system. And then in my doctoral program, we learned how to operationalize that on a systemic organizational level, which is what I've been doing now for the last few years. And so in thinking about business case and looking at this, the one thing that kept popping up into my head from a nursing perspective is that, how do I say this? You know what? I know I look good on the outside, but y'all don't know what's going on in the inside, right? And I'll suggest that for all of us here on this call and those people listening, it's the same. We don't know what other demons people are fighting, what other celebrations they're having in their life. What we see is what we get. And that's not the case. When we're thinking about change and change in health status from a nursing perspective, either at the micro level, the patient level, or the macro level, where I come in now, systematic and organizational change, we have to look at that. I think it behooves us to look at the difference between high functioning and high thriving. Two different things, right? And so I want to share that as my step off point to where my head is coming into this conversation.
I love it. And so when we talk about, you've collected us to a place of internally, there are so many things that are happening. When we talk about healthcare, we walk into a clinic and we talk to a practitioner and they diagnose us. Ariel, I'd love for you to talk about where does this holistically bring us to a gap in our understanding of what's happening here and on the outside when we are not collectively understanding what's inside, spiritually, energy, all of these things. Could you take off with that?
Of course. So I'm a holistic health practitioner and I'm a massage therapist, but I also work in energy medicine. I have been for a long time. And I'm on the other end where people come into my office looking for help because they didn't get the support they needed from the traditional healthcare system. I'm consistently hearing reports that people are not listened to, their symptoms are not addressed, they're not getting the advice, the support they need. And I see this stress in their nervous system because I can palpate it in their tissue. I can palpate this the dysfunction in their tissue based on what the support they're not getting to deal with it. And I ask them a lot of questions. Often I do support them by asking them questions and asking them to go back to their healthcare providers to get the support they need or to pick someone else. So what I'm trying to do from a holistic perspective is help people regulate their nervous systems because a lot of the stress manifests as dysregulation and that manifests as pain and suffering in the physical body. But I also see it in the energy systems. I see imbalances in flows, like acupressure points are congested, they're deficient, or they're in excess. Or I can see or work with it to help the client experience wellness. And a lot of this stuff is not seeable on the outside. It's palpable to someone who's aware of these things, like I am, but it's not, and the client feels it. They may not be able to verbalize it, but they just know that something's off. And I just ask them some basic questions when they come in, not only doing an assessment, but what's your stress level on a scale of 1 to 10? And a lot of times the fact that people give me a number like, oh, it's a 5, but when I palpate their tissue, it's an 8 or 9. And then we have a conversation about how they're functioning but not realizing how high their stress level is. And that tells me that there might be potential burnout or they're highly functioning, but that doesn't mean they're regulated.
That's no, and so this is the reality. My doctor doesn't talk to me about this stuff ever. This is not the type of care that I would get from Western medicine physicians. However, I have challenged some of these questions of, hey, what could I do differently with my body? Am I, for my holistic wellness? And there's a conversation, but it's nothing that's concrete that could actually remedy a diagnosis. So, Sean, in your experiences, understanding a perspective of we have to scale programs that are going to prove their ROI while still being holistic and mindful to the person's wellness. How have you seen this kind of morph over time? And is it possible that we could start introducing this level of conversation when it talks about the spirit and the energy and different levels of diagnoses that is not in the book? What does that look like? What is your perspective?
Well, first, the fact that you stuck me behind these two medical giants when I am not a medical person, I'm just going to let that one go, okay? Because I have love in my heart for Sapna. So let me just say that after hearing all of that. So as the person who's been blessed to work with amazing practitioners in my career, because I'm not a practitioner. I know enough to maybe be dangerous, as the saying goes, but I leave it to professionals like Greg and Ariel and Jennifer. But I love the fact that both of them talked about the things that many times in my meetings don't necessarily get talked about, right? Because that's the heartbeat of what healthcare is. Because let's just face it, the reality, and Ariel touched on some of this, and actually you touched on it a second ago, Sapna, with your experience. We all know we're in a trust recession, right? As far as our lifestyle goes, right? The challenge is in healthcare earns trust in drops, but it loses it in buckets. So it takes you long time for a practitioner to get that trust with somebody, but it can be dropped in an instant. And it could be something that had nothing to do with the practice of medicine. It could be a patient had a appointment that was dropped or misscheduled. It could be something came late that they were supposed to have that had nothing to do with the practitioner. So that's all a piece of where we're at when we have to look at the patient journey. So I talk a lot about those things. I mean, if we look at it, AI is the magic. It's not even a word; it's two letters. But artificial intelligence, right, is the magic two letters out there right now. But the reality is, the thing for me is adoption does not mean AI transformation. And I think for a lot of people who are, especially those who are coming from the outside in, trying to infuse AI into healthcare and wellness, they don't understand that piece. They think it means transformation. The reality is we're about to be officially June 1st, the middle of 2026. 75% of healthcare companies have access to AI, right? Only 13% are what we call AI achievers, mean that they have successfully integrated that into any meaningful workflow that gets to the patient. That's because they are trying to put that onto something instead of transform it. So for me, to your question, I think a lot of those conversations are starting to be had. And I 100% know that they're going to come about. But here's the challenge. Are they going to come about from inside the house or outside the house? And what I mean by that is, if we look at many industries out there today, right? Taxis, for instance. When's the last time you saw a taxi, right? The Uber and other companies came in because the consumer demanded that. They changed that industry, right? Uber Eats. Half of my neighbors that I live next to order Uber Eats 5 to 6 times a week. Yeah, I know, Errol. I'm the same way, right? Crazy. But they changed that industry, right? We are now at a point where we're looking for AI maturity from healthcare, because the patient is going to change it, right? They're going to change it with wearables. They're going to change it with a lot of other things we can go into later. But I 100% believe that that's going to be part of the conversation. It's going to be demanded. It's just whether or not healthcare does it from inside the house or outside the house.
We as consumers are demanding these things, but to me, the system is complex. It has many layers to it. There's a lot of red tape involved in these decisions that get brought in, but never actually take full fruition. And it is a whole other conversation because there's insurance companies involved. There's a whole lot of systemic things that are challenging to, I don't want to say change, but I think morph is probably the right transition, because it's going to take such a long time. And the reality is, when we talk about statistics of people feeling the burnout, feeling the pressures of their wellness inside of these environments, they are high pressure, high volume, a lot of stakes are involved. We are missing the bigger piece of how can we holistically take care of ourselves rather than being pumped with prescriptions, which brings me to Jennifer, because we had a very deep conversation about medications and the level by which we're being monitored for people that do. And this, we talked about elderly generation have kind of gotten to a place where they didn't trust it for a very long time, but then they hit a certain milestone in their life that they said, well, I've been dealing with this for so long, I'd rather just take a pill so I cannot be in pain any longer. And it doesn't have to be older generations, but if we transition the conversation to this is just not effective for our elderly, why should I accept it when I can still be an advocate for myself and try out all these other options that Ariel presented to us as well? So let's kind of talk about that, Jennifer, based on your experience and the research that you've done behind all of this.
Your question is really forming into how people can take control of their health in a way. And so for me, when I look at it, it's, there's a piece of getting informed, right? And not just going with the latest and greatest. And I feel like there's more information out there, but more information doesn't mean that it's good. We have to rely on more of the community, second thoughts on information. So I think that advocacy and really opening up to other areas, alternative, Eastern, getting into where can I go besides the option one on the table, which right now is just the medication or surgery. Those are the two common things, right? Is there another way? And also, it might be a bridge for a moment, right? But at least you're trying out something so you can feel it in your body and see what's right for you instead of feeling the pressure of, I have to go this way because that's the only way I know. So having the bridge to that is hard depending on culturally where you live, all these different components, right? But it's asking that question and becoming curious. And I'm hoping during those visits, you have somebody with you, not always, but that they can question some of that and open up the discussion a little bit more. To me, advocacy and opening up to curiosity is so important, but some of our generations, such as our parents, they're not always as curious unless somebody introduces that to them or gives them another route, right? So to me, that's where I come in, my other siblings, other friends, and just trying to open up that network for conversation.
Where do you, from everything that's been said, is there anything that one of you disagrees with as far as relying on outside holistic wellness? That means maybe staying inclusive to Western medicine. I hear it often where people go, well, after a while, you just need it, right? Like after a while, you're at the point where your chronic illness is too hard to bear. So what are some of the perspectives you have about why holistic wellness may not enter our hospital systems based on some of the traditional thinking and mindset?
I can't wait to hear what my colleagues here are going to say, but I think that chronic disease doesn't happen overnight. It's not going to be alleviated, cured if it's a possibility, ameliorated overnight. And I think in today's society, from my years of study, people want it yesterday, right? A lot of people don't want to sit and wait for the work to happen. I'm a big believer in marriage of East-West, whatever modalities are an option. Take the best and leave the rest, right? What works for me may not work for you, may not work for you. I believe in the word of advocate. My eyes lit up. I don't know if you saw it, especially Jennifer, when you started talking about advocacy, because that's what I do in my job. It's all about being there for those people who, for whatever reason, aren't there or can't be there. They may physically be there, but they're not emotionally or mentally prepared to be there. To hear that diagnosis of, I work in the neuro-oncology space a lot, so brain cancer. People aren't perhaps ready to hear that. They need, or it would really benefit people to be sitting there with them. I've had one husband die of cancer, but I've been blessed to be at all his visits with him to understand and empathetically translate what's been going on. And I've got another partner now who's going through a different type of cancer treatment and doing the same thing. Well, what about those of us that don't have that, right? I mean, how many people do we know, Sean, Jennifer, Ariel, Sapna, that don't have a Sean, Ariel, Jennifer, Sapna, Greg to sit with them, right? And so I think advocacy is so intimately important to be able to help facilitate change, and whatever modality that change is. And I say, bring it on. Whatever's going to help me and my blood pressure, let's go.
One thing I would love to add to that, just playing off from this, is my one cautionary tale is just because it's not Western doesn't mean that it's still going to serve you, right? There's energy, there's functional medicine, integrative medicine, and it might just take you down a route of many supplements instead of medications, right? So there could be this offset that you weren't expecting. And so that's just something that sometimes I throw caution at, that there's a lot of great non-Western areas to explore. I just wouldn't want it to be all of a sudden now I have a cabinet full of supplements and spending thousands of dollars and just hoping for the best.
And can I ask, sorry, maybe Ari, you can help answer this too. What are we calling Western when we're saying non-Western?
Let me give you a diagnosis and let me give you a treatment, be it medicinal, be it device related, be it surgical related, as Jennifer pointed out earlier. Western medicine is what's taught in, the Western world. I hate to say it like that, but it's you've got a disease, let me fix it, let me cure it.
I would add to that in my mind, I always have considered Western medicine to be not only the diagnoses, but then it's the treatment that requires a prescription medication, not let's do yoga for 6 months. Let's think about what your diet is right now. I go to my Ayurvedic doctor for that kind of thing. My latest one, who I was like, I want a weight loss drug. And she was like, why? What's wrong with you? And I was like, I gained weight and I want to lose it. She's like, what else is wrong with you? Nothing. Do you have diabetes? No. High blood pressure? No. Do you want it? And I said, no. She goes, well, then I'm not going to put you on a weight loss med. I was like, okay, bye. Thank you. Because that's the type of practitioner that I would want that I would assume would happen in an Ayurvedic clinic. Any other doctor that I've known has, here you go. Happy for you. Go ahead and go lose weight and we'll see you back when you have diabetes or you have underlying cancer. That's a perspective. That's my opinion. And I think a lot of people are doing other things, and so I don't want to put opinion on that. I'm just saying that that's what I see differently between Western medicine and Ayurvedic or non-Western.
And I'm going to jump in here a little bit too. Okay. So the thing is, this whole conversation is how do we bring this to scale, right? So a lot of holistic medicine is based on a preventative model, we're looking at the whole person, right? We're looking at what is you're presenting with some symptoms. Where did they come from? What's the etiology of those symptoms? How did this progress? How did this develop? How can we treat this in scope of practice, right? And the thing is, a lot of the problems that people come to me with are because they either didn't get support from their doctor, they were gaslit by their doctor. Specifically, that one, I've heard it thousands of times. They're not getting the support they need because I'm not sure the doctors are equipped. The system of Western medicine is about putting out fires. It's not about, growing the grass and so that you can control a fire risk or whatever, right? It's not about that. It's about treating a problem. And because unfortunately it is financially based, it's financially oriented. I mean, there's a thing. If you're going to bring holistic understandings in and preventative approaches into a Western medical model, the whole model is going to have to change. And that's expensive. It's very expensive. Or it's not. Here's the thing. It doesn't have to be. And I think you guys probably know ideas and options, but this is the story that I've heard out in general media is, it's expensive for people to take care of themselves. So let's just wait until they're really, really sick. And then they go see their doctor. Right. And what I do is I help provide preventative health care to manage people's whatever symptoms or challenges by helping them regulate their nervous systems and their energy balance, but also just to reduce the pain and stress in their physical body. Because that's what I'm doing when I'm doing a therapeutic massage with people. The thing is, some of the stuff is not that expensive. And it looks like you guys have some ideas. I'll bet there are some ways we could scale this up that could be workable. But then there's also the resistance to that's in the system itself.
Yes.
100%. And I had to restrain myself from going, full Kong on that whole comment. Yes. But let me just, I was like, you saw me. I was like, okay, but two things. Number one, it's all about how the money is made. Unfortunately, my mom ran a hospital in Outer Banks, the only hospital for all the islands there in North Carolina, Killable Hills, Kitty Hawk, all those islands, for 25 years. She just retired 2 years ago. The number of arguments that she would call me up complaining that she had because she had good practitioners who wanted to do some of the things to deal with more of the holistic portion of the patient, but they couldn't because the hospital could not bill for that time, right? So I totally agree with you, Ariel. It's not, not to disagree with Sapna because I love her, but it's not about morphing the system. The system needs to be blown up and nuked and rebuilt.
Yes.
So that's the first thing. The second thing is, and you'll know, those who know me personally, I talk a lot in movie terms because I have a passion movie production company. So I'm going to delve into that for just a second. So the other part we have is psychological, right? So how many of us these days, because of the amount of information we are inundated with, if somebody asks us, do we want to watch a 2 hour and 45-minute movie, or would we rather watch a 55-minute episode of a series, which are we generally picking, right? Most people I know are going to pick the 55 minutes. The problem is, right, if you look at that, Netflix has figured this out, Amazon Prime has figured this out, Max has figured this out, is if you give me the 55 minutes and I love it, I'm going to continue watching it. And then 6 hours later, I'm finishing up the episodic episode, right? What wellness needs to do to scale and what healthcare is going to have to do, it's going to have the same mentality. It's going to have to provide that 55 minutes, but it's really the long scale of wellness that's going to be overall. So the psychology is overcome for the patient. Instead, they just are presenting the 2 hour and 45-minute movie.
My experience in healthcare, where I, for a moment, instead of being a consultant, jumped in and became a leader in organ transplant and mechanical devices. What I noticed there is the system was waiting too long. They were letting patients progress. Let's say, for example, heart failure. They knew the time was before AI and everything. They knew in about a 5-year period, they'd need the next intervention, either therapeutic that way or surgery. So they just let them go on this progression. Instead of, even though we had dietitians, social workers, everything involved in organ transplants, because that's part of compliance. You need the holistic view of a patient, and I put that in air quotes. What they were doing is allowing this to flow, right? And disease progression. Then they became advanced heart failure. And the same for kidney, liver, lung, all this. And there are trauma points, so that's different. I'm just talking about when somebody has a disease state that progresses. For me, I really see that the system needs to intervene earlier. And there are ways of getting reimbursed for this. It's just in this period of time, there's a bridge, and it is harder to do, especially when you have large facility costs, when you have a large overhead. But we've seen it through places like ChenMD, Nuka Health, different environments where it's, I would say, a hybrid, and I'm not going to go to value-based care because I feel like there's issues with that too, but talking to the payers and being able to say, I will take the weight of this patient, give me the bucket of money, and I will see them regularly and get them off this train of metabolic dysfunction, kidney disease progression, all these different things through many other things. Now that intervenes with alternative therapies as well, nutrition, lifestyle, and other interventions. So I've been seeing this a little bit, and it does work in some models now, but it's still not 100%. They have been able to undo the progression for some patients. And I'm not talking about necessarily trajectory of organ transplant, but people that had kidney disease, liver disease, things like that. So it could have been a candidate for in the Western medicine. But those systems are working to undo some of the damage that patients have people living their lives and being on their day-to-day, whatever trajectory. They've been able to intervene, see them regularly, and get them on a better progression. So I have hope that there is a little bit of a bridge, but I 100% agree with you. We need to start over and do a whole redesign. But I think that redesign really needs to bring us into the community, into the homes, because that's where life happens. Not when I come to you episodically and see you at an appointment. Life happens outside of that appointment, outside of that telehealth moment in time. And that's really what we need to talk about, is how to redesign so that it's a life intervention, of the journey that a person is on, not a patient.
Absolutely. And that's where, that's why you have all the major AI companies and software companies are coming after healthcare, right? That $3.5 trillion market is ripe and is ready for personalization. I spoke at and attended CES earlier this year in January and talked to a company who is one of the things I thought was the coolest, and I don't know, maybe I'm weird. I know I'm weird, but this is cool to me, is that they have a AI monitoring toilet, right? Because if you have somebody who has things appearing in their fecal matter and their urine early enough, that's going to be long time in many cases before they're going to have to be symptomatic and go somewhere and take something off. But to your point, Jennifer, that personalization where you can have that monitored every day. I mean, who doesn't go to the bathroom? So it's like that to me makes the most sense. And we're moving toward that, right? Because that early intervention, that behavior prediction, the engagement support, the adherence tracking, the scalable follow through, that is where healthcare is going to go, and it's going to have to go. Once again, we go back to the question though that Ariel brought up, right? Which I love that she did. This is why she's got that big brain, is because it goes to the money, right? It's where is the money coming from? For years, I helped a company open lots of clinics across the country that were all preventative, right? And so you had regular people who were coming in saying, listen, I don't necessarily have a symptom, but I'm kind of worried. And my parents had this at this age and this kind of thing. I'd like to get checked. And the number of meetings I had where we had people from the hospital system, the insurance companies, the pharmacies who would come into our meetings and try to block us coming to those cities was amazing. And the number of people who wrote me letters and cards later because we found a heart issue, a heart defect, lung cancer, all kinds of things that literally, I mean, maybe it did or didn't, but to their viewpoint, it saved their spouse or their lives is amazing to me. So it's coming. It's once again, how do we reconfigure the system? And to your point, Jennifer, all those things you say with Oregon, I totally know that. I know that from some of the companies I've worked with. The challenge gets to be, though, if you can't deliver those results in a quarterly basis, that money is not coming to you.
Yep, it is. Or you eat up the whole pot of money, right? Because
Absolutely.
they end up in an inpatient situation or something.
I've written so many notes. So,
Yeah.
so thank you. I'm in 100% agreement. Things need to be revamped. And show me the money. Where was that from? Jerry Maguire. Show me the money. Yeah.
Show me the money.
It's truly about that, right? So when I was a practitioner in Baltimore as an outpatient practitioner, I had 12 minutes to see a patient, 3 minutes to document. Woohoo! Long time, right? 4, 5 patients an hour. I would have patients come into a primary care clinic with a list of 5, 6 problems, and I would have to say to them, pick 2. We'll deal with that. Come back in 3 or 6 months and we'll deal with the rest of it. And from a clinician, how frustrating is that when you just want to take them and hold them and say, okay, here, meet me in the alley afterwards and we'll figure this out to do it. It's to the point where my own clinician here where I live gave me someone who knows how the system could and should work, the same leeway of 10 to 12 minutes per visit, that I signed up to go to a concierge practice. I'm lucky that I can afford X amount of dollars a year. I shouldn't have to spend X amount of dollars a year for somebody to be my quarterback, to give me at a moment's notice, half hour, an hour of their time to sit down and talk with them about what's going on. I want to talk a little bit, just a moment, about AI. In my world, AI is available for pattern recognition, at least in my mind today, right? It's not ever going to take away the human need of decision making, because we as a group can see the whole picture, hopefully, if we've investigated what's going on. AI, garbage in, garbage out, right? If you don't feed it the right way, it's not going to give out what you need. And then one last thing I wanted to mention, to be on the board of, and we're doing passive AI assisted quality of life recognition with something as simple as your phone. We all carry a phone. So let's take a look at it and validate, what is your quality of life that you're living when you're not sitting in front of Ariel or Jennifer or Sean or anyone, to tell them, what's really going on. Does that make sense? I think that's really important. I'm really excited. We're presenting data this coming weekend in Chicago about this on a world stage. So I'm very excited about this, but I think it's, there's a lot a lot that we're talking about here. But I'm sorry. My question then would be, what's the next step? What step
Yes.
could we take today, tomorrow, by the end of the year to move things forward?
Now, I'm going to jump in real quick. I want to jump in real quick.
Okay.
AI is not only is healthcare coming for AI is coming for healthcare. And let me explain. My clients come in and they've gone on to AI asking for help about their symptoms. Some of them are having really bad anxiety. And part of my job is to help them regulate their anxiety through in scope work that I do. But they're doing research because they can't get in touch with their doctor. Their doctor's not giving them answers, or they just can't get the support they need. And as you said, 10 or 12 minutes or 15 minutes, that's not enough time. I spend 60 to 90 to 120 minutes with my clients. So we have in-depth conversations about these things. But AI is a tool that people are bringing in, not even just with measuring devices. They're just like, something's wrong with me. My doctor's ignoring me. What do I do? I need help. And they start asking questions. I don't know if that's part of the answer, but it's part of the reality. It's part of what's happening.
So,
Yeah.
but okay, and absolutely, and one thing I want to say, I love what Greg just said, but I'm going to be a little contrarian here. Okay.
Yeah.
First thing is, number one, I want to make some T-shirts that say "Meet me in the back alley." Right. That's the first thing. I
got your back. I got your back.
Thank you. I'm happy to share in that, Greg. That was yours. I'm not taking credit, but I want to be a part of that. Secondly, unfortunately, I disagree that healthcare is not going to replace the human touch, right? And let me before everybody loses their mind and goes all crazy on me. Right now, we are nowhere near for the human experience to be translated properly through AI. We're not close yet, right? We're not close. But to Ariel's point, when you have absence of something is going to be filled by a human, whether it's good or bad. That vacuum always gets filled. If you all remember a movie about probably now 10 or maybe 10 or 11 years ago called Her, right? Where the person had a relationship with AI because they had no one else, right? So the challenge we have right now, the companies that are, and I deal with companies in almost every country. I mean, I'm in the world at this point, and it's so different to see how it's being handled in Europe. It's totally different than we're handling it here. In Asia, it's 1000% different, right? But the challenge is that we are here in the US, especially, are just looking to take AI and bolt it onto something. We're trying to automate healthcare. The problem is the healthcare system here is incredibly fragmented, right? I can't go to a general practitioner and not have 7 other specialty appointments set up, right? Those practitioners can't see each other's stuff. So and they all get paid different places. So it's if you automate fragmentation at scale, all you're doing is automating chaos. So I think eventually we're going to get to that point where there will be some options. And we're already seeing that move now. If you look at the data from the industry, from the British institution, 3 years ago, about 9% of the people, when they would call into a healthcare practitioner, were okay with AI answering questions or booking their appointments. If you look at the data from last December, we're at 39%. That's less than 3 years, right? Imagine what it's going to be 3 years from now. So, I'm not saying that to scare anybody or say healthcare is going to take away humans. I think there's going to be a place for that interaction altogether. But I think if we don't look at it like that, we're not going to look in the right places where humans can't be replaced, and we're going to be behind, and it's going to lag. And what ultimately, it's not just going to hurt the practitioners and the healthcare industry, but it's going to hurt the patients, because to Ariel's point, the patients are going to go to other places, and many of those other places are inferior because you have software engineers who are trying to fix healthcare problems who are not talking to healthcare professionals. Like I spoke at the Tissue Repair Summit and the APWCA organization event last week in Austin, meeting with people from Mayo Clinic and St. Thomas and all these major hospitals. They're feeling it already. They have the 5.5 minutes their practitioners have is, to Ariel's point, is talking people off of stuff that they heard from an inferior source. So it's happening. But I loved your question though, and sorry I didn't mean to go this long with this. This kind of hit a nerve for me. But with that, the one thing I would say, the way we fix it is we don't worry about AI for the moment, and what we worry about is the patient journey and the workflow in the hospital and say, okay, let's look at this right now. How do we make this the easiest and frictionless for the practitioner, whether that's wellness, whether that's traditional medicine, whatever that is? To Jennifer's point, home health is going to be, in the next 5 to 10 years, is going to explode, because we know the hospitals are closing, right? I grew up in a small town in Indiana. My hospital's about to close, right? So they still have people that are going to need to be seen. And I'm a history buff. So if we remember, it used to be the doctor used to come to your house anyway, right? All we're doing is going back to that cycle. So all of that is how, to me, when I have these meetings with companies, with practitioners, with individual clinic owners, that's the first thing I say is, look, forget automation, forget software, forget AI. Let's audit and look, what is the best and frictionless workflow for you and your patient? And then once we do that, then we can figure out how we put AI into it, or whatever automation or whatever we're doing, and then how we maximize the expertise, like the expertise we have on this call, this webinar. You guys should be, not, to your point earlier, Greg, you shouldn't be having 3 minutes to talk to somebody and the rest of the time being able to note stuff. Like we should be well past it. So sorry, I didn't mean to
No, you didn't.
Yeah.
Everybody's talked about how are we going to get there, and that's what the intention of the business case was, right? Is that we are going to hear perspectives of where you each come from and your lens of experience and where you are now, given the way the environment is shifting. So the reality then is, when you talked about this morph, when I say morph, by the way, I think of it as it's going to take time. You can't blow up an entire system realistically. So when I say morph, what are you going to look at that's going to be transitionary? First, second, third, how does this look when a system gets blown up, when it's as big as healthcare? It takes a lot of realistic measure and strategy. And so I want to hear from you guys on what is the most critical component when you think about, we're going to transition our approach in medicine to something that includes wellness and holistic approaches. How does that look when you're talking about scaling the business, continuing to look at, we are financially required to meet a certain return on investment by the end of a quarter and end of a year? This is where the pressure and the heavy comes in.
Just going to add in around that. One thing that I feel like in this bridging, we still have this model, right? How do we hold it together but still advance? Because we do need the redesign, right? We're in agreement there. I think we really need to, and a few people are doing this in the community. There's different touch points, community health workers, there's nonprofits, there's ways of tying in an integrated team. I want to move away from, you have one doctor and they're going to hold you together. Whether that's a PCP, whatever it is, they're going to refer you, they're going to know you. I think we're past that at this point. Your panel size too large. If you have 2,000 in your panel or 1,500 if you're academic, whatever it is, I feel like we're past that point. So how do we integrate? And there's payment models around this. There's ways of everyone getting paid for this too. But having somebody in your environment for the high risk, for the people that are moderate risk, that we're seeing signs, right, of patterns that they're starting to go down the sick path, right, that they're progressing. And there's different AI tools that we can use to help with this. And just one, for example, they're testing out, and I think it's Stanford, Microsoft, and a few others down in Texas, doing retinal scans. And they're able to predict if you're going to be diabetic in 10 years, or if there's a progression or a pattern that you're living with, whether it's DNA, how you're living, whatever, that's showing up and from your eyes, and then you can be referred for a care journey instead of coming into your PCP and having them to intervene before you progress. There's a lot of different things that we need to do, but really getting into that community model and that integrated team, how we work together. And to Sean's point earlier, we do need to bridge it with EMR, somehow communication path, which there's tools out there that we can do it with, but creating more of a team concept. I say, going back to my organ transplant days, we had a team concept. We just need to advance it more. We used to have endocrinologists, pathologists, surgeons, cardiologists, everybody taking a snippet. Now we just need to take a more advanced look at that and bring it into the community and seeing what lifestyle and other interventions at home, at work, wherever it is, to create more of a team concept.
Well, I think making team using a team concept would be blowing up the system. I totally agree with you, and I was going to suggest that. Except you also need to have holistic practitioners on that team.
Yes, 100%.
You need people who are somatic practitioners, like massage therapists. Thank you very much, because a lot of the soft tissue problems, or how about the lymphatic system?
Yes.
I work with that in my medical massage practice extensively. That is not being implemented, and a lot of people wouldn't have a lot of the problems they have if they had proper treatment. So it's opening it up to more practitioners and giving people access to like a circle of people. Like there's a circle of people on their team, right? And then they can access these different people. That doesn't have to be more expensive. I'm sure people could figure out a way to make this happen that's doable. I think the excuse of not enough time and not enough money, which is what everybody has that excuse for not doing something, or not enough political will. I think all of those things could be overcome. I think it is doable, but they need to treat human beings like human beings and not like a bunch of dollar signs. And they need to treat us like we have a nervous system. It gets dysregulated. We have emotions. They get out of balance. We have consciousness. We have energy flow. There's a lot of studies out there talking about how all of those things influence the physical state. It's reality. We're human beings. We have all these things happening, and these things also affect our physical health. So just expand the team to include some other practitioners, and I think people's results will be a lot improved.
100% in agreement.
Yeah,
It's
absolutely. Now, here's the thing I would say though. It's that in the meetings I'm having, it's not about the money. It's about risk management. It's the records. It's sharing the records. That has been every conversation I've had at any high level. It always comes back to how do we do that, but we keep ourselves safe from litigation. It's sharing the records. And let me say this as a U.S. Army war veteran, but we need to look to what other countries are doing. The reason 3 years ago we were 2.5 years ahead of China in AI development, and now we're almost neck and neck, is because we here have 7 major software companies who are fighting to be king of the hill and to make and extract most amount of money from healthcare as they possibly can. In China, they went open source. So they share everything, right? That's why they just, one of the first automated hospitals has now opened up in the UAE and also in China. Because of that, that's all telehealth, right? We could do the same thing, but everybody wants to be the big king on the hill, and they want to be the last person or last company standing. And instead of putting the healthcare needs as the first thing that we're thinking about, that's not what's going on. But for me, I agree with everything everybody just said. But like I said, every meeting I ever have, that's the stop, is risk management and how do we share the records without getting sued into oblivion.
I had a podcast before that was about global healthcare, and we talked about what are the differences domestically versus internationally when it comes to AI. India practitioners are so focused on their human-centered approaches because they're training people to use AI. They're not leveraging this scare tactic of we're going to replace you with these new solutions. And it's because their people are their biggest commodity. They are their economy. They don't have the fruits of power and money to make these changes without their people being on board, because they're the ones that they're serving them, right? So I think it's an interesting viewpoint on global. You think about this holistic approach, people that have to the point of cancer being at their last stages end up getting their care team, right? There's 10 people that are caring for these folks, and you're like, dude, this is beautiful. And at the same time, they're stage 4. So when we talk about risk and the risk of associating people's personal data and these things, when it's gotten to the point of the end of life plan, we need a care team, and not so much early when we talk about prevention, Jennifer, when we talk about Ariel's side of holistic wellness. So Greg, I love your perspective, because this is the reality when you're inside as a practitioner of when are you going to bring other practitioners in? What is the resistance to that until it gets so severe?
Yeah, great question. Thank you. Lawsuits. I was a hospice nurse for 4 or 5 years back in the day. And you're absolutely right. When we were talking about end of life care, last 6-ish months of life, we brought everybody in the band together, right? From spiritual to massage therapy to bereavement counseling before anyone has died, nurses, nursing assistants, social work, PT, OT, whoever and whatever was needed, we brought in. And even if they weren't needed, they were brought in to do an eval in case they were needed later so that they would know the person was going on. It takes a lot of time, right? And how does one do that in today's world when I work 9 to 5, which is really 7:30 to 7:30, 5 days a week. And you know what? Your office is open 8 until 4:30. I don't have 8 hours of PTO I can take to come and see you guys. That's a portion of it. We're talking about meeting the patient where they are. And I went to a school in Appalachia, Frontier Nursing University, for my DNP. This is where the nurse midwives went into the hills on horseback to birthing those babies and taking care of everything from birth till death, right? They were meeting people where they need to be met. They took the resources, whatever they needed, be it other occupations, spiritual guidance, massage therapy when I was last at school. And I think that's fantastic. I think that there's a lot of opportunity. Mobile homes, right? Turned into wellness clinics. University of Maryland does that throughout the state of Maryland. A lot of other places do that too. And I think that would be a great place to not just have it staffed with nurse practitioners, thank you very much, but with Eastern philosophy of care, massage therapists, there, other people. Comes down to lawsuits and bucks. Who's going to pay for it?
Absolutely. And it goes back to what I said earlier. Movies, you choose a movie because it has a defined ending. A series doesn't. You don't know if it's going to be 3 seasons, 7 seasons, 11 seasons. And so to Greg's point, there's no way that that money gets allocated because they don't have an ending in sight. With end of life, there's a predictable ending in sight. So they will bring all those team members in. Doesn't make it right, but it is what it is.
And I think that's what value-based care was trying to do. I still am not 100% in agreement with, fee-for-service isn't working, but value-based care there's still more we need to do on that. But I think it was a bucket of money trying to, keep somebody out of the hospital because they're diabetic or, metabolic issues, whatever it is. So it is back to the payment models, what's acceptable, but it doesn't mean that we can't push on this now. We have other studies, we have other discussions. It's just having the right voices and getting in with certain payers right now to make the change. Now, future, we can look at something else, but it's effort right now and bandwidth of people.
I'm going to just go out on a limb here and say, I don't think we solved what we set out to solve. There was the approach of holistic means including more practitioners in the care as a grounding start. But I still think there's so much more as far as mapping out what this strategically could look like with your guys' minds. I want to drill into a realistic approach. It's a holistic approach that really hits home when you say, we're going to implement AI, but we have all these things that are broken in the system. And how do we remedy some of that? Which means that I, as a patient, can come in and say, I want 4 people here that have different lenses for my care when I'm just getting diagnosed with the first thing that might affect my health long term. Long story short, I hope we're not finished, even though we're done today. You all are fabulous. Any last statements that you guys want to make before we close out?
I'm just trying to think of some of the topics that I still want to explore are really around reactive versus proactive, mindset, and that's nervous system as well as leadership in general. How are we going to be able to move anything if everyone's playing the whack-a-mole game? So that was one thing. The other thing is I feel like there's a gap even in IT, which is they're used to maybe agile thinking or waterfall. This AI thing is completely different for them. So our maturity level in a lot of the organizations are maybe ambient listening they can get into, but they really don't have the maturity or the skill set in-house to develop things. Those are some of the things maybe for next time that we can address or add on to. And I'm sure
Thank you, Jennifer. Yeah, there is so much more.
Absolutely. And I would just say that, the one thing is anytime there's something that's systemically has a lot of challenges, the great thing is there's a lot of great possibility. But I think to Jennifer's point, there's a lot of people that don't understand that old saying, you can't separate the promise from the peril. So there's a ton of promise with AI. But there is some peril that has to be addressed and has to be looked at. And I'm 100% agreement on the continuation of how that process needs to be bringing more people into it, whether it's advocates, which I'm so glad that Greg and Jennifer talked about that. I think Ariel mentioned that as well. Having the full sets of teams, I think that is where we are going to go. And once again, it's just the companies that are going to be around. And I stopped using win about eight months ago. It's really just going to be about being around, because we talked about whether it was morphing, which I agree with your definition of morphing, Sapna. But the challenge we have right now is we have legislation that literally is blowing up healthcare. Like, people don't understand, because when the back end of the BBB comes and how that funding gets taken back and what gets limited, it wasn't a gift. It was somebody loaning me $20 and telling me, hey, I want $1,000 next week, right? So it's being blown up. And to Greg's point, he mentioned concierge medicine. That is going to be another amazing avenue. And we're just going to see a ton of separation. I mean, we've seen it historically. We're going to see a ton of separation. But just remember, you cannot separate the promise from the peril. And just know that there is going to be some of that, but there's a ton of promise available for the people who are willing to sit down, look through it, use their expertise, and if nothing else, use their humanity first.
And I would just jump in and say, I didn't expect us all to resolve the perils of modern healthcare in America in one conversation. But I think some great thoughts have been shared here, and we're looking at what some of the problems are. And I think that's a good way to start exploring, like, what could happen next, or what could open up or change next. So it's been a pleasure interacting with everyone and hearing all of your perspectives. It's been great.
Same. And if I could just say that we've been talking about holism, holistic, whole person wellness. And I think it needs to move for a lot of people. It's very inspirational, right? To have this thing where everybody has a team of people looking at them and being with them. It's got to go from that inspiration to true infrastructure. It's got to be part and parcel. Now, how that's going to happen is a question for the ages. Hopefully not too many ages. Hopefully in our lifetime, we can see some movement towards that. But it needs to go from, hey, isn't this a good idea, to let's get off our fat you-know-whats and do something.
Yeah.
Our fat toes, Greg.
Our fat toes, absolutely.
Yeah.
Yep.
I don't have fat toes. They've been called twinkle toes, but not fat toes. So as we wrap, I just want to summarize from a whole person health. It's no longer nice to have. It's core to how we care for people and how we as organizations are performing. I think that the opportunity is vast and more than ever to design differently, measure differently, think of this as strategically leading differently in so many ways. So these wellness efforts match the reality of people's lives. That's the holistic approach that we all, I think, landed on. So thank you, Sean, Ariel, Jennifer, Greg. You guys are fantastic. Thank you for joining us. If this resonated, connect with me and your panelists and keep coming back to Shifting Pathways for more conversations, practical, honest, and built for how work is changing.